It's time for The Doctor Is In, and this morning we're talking about osteoporosis and salt. And joining us this morning is Dr. Ira Zunin. He's the medical director of the Manukau o Malama Integrative Clinic. Good morning, Dr. Z, and thank you so much for joining us. Thanks for coming in. And really quickly, a new study about osteoporosis just came out. What does it say?
Well, it says that we should think about screening women even earlier than we had previously thought. Recommendations before today were certainly by 65, maybe between 60 and 64, but now perimenopausal women should be screened depending upon risk factors. That's as low as mid-40s to mid-50s.
That's good to know. And moving on to salt, the Centers for Disease Control said that Americans are just eating way too much salt. And is it really that dangerous?
It is dangerous, Maria. You know, if you have too much salt, the body's designed to get rid of the extra salt that you don't need. It passes through the kidneys into the urine, but you can overwhelm the system. And if you do, it raises the blood pressure, raising risk of heart attack, stroke, and kidney disease. It's dangerous.
So how much salt should we be eating, and is there really a safe amount of salt in our diets?
Well, first of all, most of us are eating in a day what we could live on in a month. But the recommendations are not to eat more than 1,500 to 2,300 milligrams per day, depending upon the health status.
Now, when I'm eating something, I'm not exactly calculating all the milligrams. So what are some of the foods that people should just avoid to avoid having too much salt intake?
Right. Well, 3/4 of the excess salt comes in processed foods. Sausage, lunch meats, and I know this is going to upset Dan, but Spam, and also all that fast food. Only 10% comes from what we put in when we're cooking or on the table.
And there's so much of it everywhere, and it's hidden in our food. So is there anything being done for some solutions for consumers out there?
Right. Well, there's a big discussion now about whether or not the government should be starting to regulate how much can be put in restaurants and in processed foods. But I think we may want to think first about how much salt is in the food that our children eat in that school cafeteria.
And Dan was also upset about menopause. It's a real thing out there. It's sort of like male menopause.
Yes, you know, it's different than female menopause because female menopause happens at a certain time when we stop having our menstrual cycle. But certainly the testosterone levels in men start to decline really in the 30s and certainly declined by the 50s.
Oh boy. Well, I know he was not too happy about that one.
He's been having a bad day.
Oh, Dr. Z, thank you so much for joining us. I appreciate it.